Let's talk about your liver. You know, it's one of your body's most incredible, unsung heroes. But what happens when this absolute powerhouse starts to fail? Today, we are diving deep into liver cirrhosis. It's a condition that affects millions of people all over the world, and it really represents the final and often silent battle for this vital organ. We're going to uncover how a perfectly healthy liver can be pushed right to the brink and what that really means for your entire body.
Okay, so look at this. This is the whole story in just 2 images. On the left, you've got a healthy liver, it's smooth, it's ready to go. And on the right, well, that's the reality of cirrhosis. That's a liver that has become a battlefield of scar tissue, all shrunken and hard and bumpy. The difference is absolutely jarring, right? It's the physical proof of a silent war that's been happening inside the body.
So this brings up a really fascinating question. I mean, the liver is a superstar when it comes to regeneration. It can literally regrow itself. So how in the world does an organ with that kind of superpower end up in a state of irreversible failure? That is the mystery we are going to unravel today.
All right, so before we get into how it all breaks down, let's just take a moment to appreciate this incredible machine. Your liver is an absolute workhorse, performing over 500 vital functions. But, you know, even the strongest fortress can fall if it's under a relentless siege. And the road to cirrhosis, it starts with a constant, long-term assault on this amazing organ.
So who are the culprits in this story? Well, the list is surprisingly long. While heavy, long-term alcohol use and viruses like hepatitis often steal the spotlight, a whole host of other things, from our own immune systems attacking us to metabolic disorders, can set the stage for liver failure. Let's zoom in on alcohol's impact for a second, because it's a major driver of cirrhosis globally. Now, this is not an overnight process. As you can see here, it's a gradual decline. It often starts with a fatty liver. Then it progresses to inflammation. And if it's left unchecked, it can end in the irreversible scarring of cirrhosis. And the key factors? It's really about 2 things: how much and for how long a person drinks.
And now, let's turn to a rapidly emerging threat: non-alcoholic fatty liver disease, or NAFLD as it's known. This condition is pretty much marching in lockstep with the global rise in obesity and diabetes. You can think of it as this quiet storm, just silently causing damage that can eventually lead to complete liver failure. It's a huge deal.
So we've got the injury, but how does that actually turn into permanent damage? Well, you might be surprised to learn that it's the liver's own attempt to heal itself that ultimately leads to its downfall. It's a tragic irony, really. Let's see how this whole process goes so wrong. Here it is, the step-by-step journey to liver failure. It all starts with a healthy organ. Then, persistent damage leads to a buildup of fat, creating what's called a fatty liver. Now, if the assault continues, you get inflammation and the first layers of scar tissue, or fibrosis. Without any intervention, this scarring just gets worse and worse, completely remodeling the liver into that hardened state we call cirrhosis. So let's be super clear here. Cirrhosis is way more than just scarring. It's a total architectural collapse. The liver becomes this chaotic jumble of scar tissue and these newly formed, disorganized lumps of liver cells. This whole mess just completely wrecks the liver's internal highway system, making it pretty much impossible for it to do its job properly.
And who's the main player in this whole destructive process? It's this specialized cell called the hepatic stellate cell. Normally, it's a pretty quiet cell, just hanging out, storing vitamin A. But under chronic injury, it wakes up, it gets activated, and it transforms into a collagen-producing machine, just relentlessly laying down the fibrous scar tissue that defines cirrhosis.
You know, for a long time, this whole scarring process can be completely silent. But there comes a tipping point, a point where the damage is so severe that the liver just can't keep up anymore, and that's when the life-threatening problems really begin to appear.
I want you to think of cirrhosis as having 2 acts. In Act 1, you have compensated cirrhosis. The liver is scarred up, but it's still managing to keep the show on the road. People in this stage often have absolutely no idea there's even a problem. But then comes Act 2, decompensated cirrhosis. This is when the liver's reserves are totally exhausted and the curtain rises on a whole host of serious, life-altering complications.
Okay, so the central problem that triggers this whole decompensation thing is called portal hypertension. The best way to think about it is like this. All that massive scarring in the liver acts like a giant dam, and it blocks the normal flow of blood that's coming from your digestive system. This creates a massive traffic jam and a really dangerous buildup of pressure in the main vein leading to the liver.
And this traffic jam has absolutely devastating consequences all through the body. The intense pressure literally squeezes fluid out of the blood vessels and into the abdomen. That's a condition called ascites. It also creates these dangerous detours, forcing blood into fragile veins that can rupture and cause massive internal bleeding. And maybe the most insidious part, a failing liver can't detoxify the blood anymore, allowing toxins to travel up to the brain and cause confusion and major cognitive problems.
Here's a closer look at one of the most terrifying outcomes of that portal hypertension. So, to get around the blockage in the liver, blood starts carving new paths through these really delicate veins in the esophagus. But these veins were never designed for that kind of high pressure, so they swell up into these fragile balloons called varices. If one of these ruptures, the result is severe, life-threatening bleeding. It becomes a frantic race against time. So, given that cirrhosis can be such a silent disease for so long, how do doctors finally figure it out? Well, they basically become detectives, looking for clues both on the surface of the body and deep within the bloodstream.
When the liver is really struggling, it can no longer regulate hormones properly, and that leads to some really telltale physical signs. The most famous one is jaundice, right? The yellowing of the skin and eyes. But doctors are also looking for more subtle clues, like these tiny spider-shaped blood vessels on the chest, or a distinct reddening of the palms. And in men, it can even cause the development of breast tissue, a condition we call gynecomastia.
Blood tests, of course, give us a direct look at how well the liver is doing its job. Each one of these markers tells a piece of the story. High bilirubin levels, that tells us the liver is failing to clear out waste products. Low albumin, that's a sign the liver's protein-making factory is shutting down. And a high INR, well, that means the liver isn't making the factors your blood needs to clot properly, which is very dangerous.
So, a diagnosis of cirrhosis marks a huge shift in a person's care. And while the scarring itself can't be undone, the focus turns to a whole new strategy, stopping any further damage, managing the symptoms, and preventing the most dangerous complications from taking hold. Now, to manage it effectively, doctors first need to know how severe it is. They use scoring systems, like the Child-Pugh score you see here. By combining lab results like bilirubin and INR with physical signs like ascites, they can actually classify the severity of the cirrhosis and get a much better idea of the patient's prognosis. It's like a report card for the liver.
The management plan here has a lot of moving parts. First and foremost, you have to stop what's causing the injury in the first place. If it's alcohol, complete abstinence is absolutely non-negotiable. Then, it's all about supporting the body with good nutrition, protecting the liver from any other infections, and actively treating complications like that fluid buildup as they arise.
But what happens when management just isn't enough anymore, and the liver is really in its final stages of failure? Well, for some people, there is one definitive, life-saving option left on the table. And this is it: liver transplantation. For patients with end-stage cirrhosis, replacing their diseased liver with a healthy one from a donor is the only definitive cure. It is a massive surgery, no doubt about it, but it can dramatically improve survival and offer a true, incredible second chance at life.
Ultimately, the story of cirrhosis is just this powerful reminder that our bodies are often fighting these silent battles we know nothing about. The liver, this tireless worker, might not send out any distress signals until it's right on the verge of collapse. And that leaves us with a really critical question to think about. Your liver is working silently for you right now. Are you listening?